In these series of recordings, I'll be helping you to understand the anatomy of the vertebral column. Upon completion of the unit, you should be able to describe the typical curvatures of the vertebral column and understand how they develop. You should be able to describe the features of a typical vertebrae and identify further features of atypical vertebrae, the atlas and the axis within the cervical region. You should also gain an understanding of the differences between thoracic, lumbar and cervical vertebrae. 1.01. The vertebral column. The vertebral column, or spine, forms an integral part of the axial skeleton, shown here in green. It acts to support the body against gravity and to transfer the weight of the upper body to the lower appendicular skeleton via the sacroiliac joints. On closer inspection, we can see that there are 24 unfused vertebrae separated via intervertebral discs, along with a sacrum comprised of 5 fused vertebrae and a coccyx comprised of 3 to 5 fused vertebrae. The cervical spine, on closer inspection, is comprised of 7 vertebrae, labelled from the cranial or head end as C1 through to C7. 3 of these vertebrae are referred to as atypical. The thoracic spine, in a similar fashion, has 12 vertebrae labelled from the cranial through to the caudal end as T1 through to T12. These vertebrae articulate with the ribs. And on to the lumbar spine, where there are 5 vertebrae labelled L1 through to L5. End. Curvatures of the vertebral column. Were one to look only at the anterior aspect of the vertebral column, or indeed its posterior aspect, one would be forgiven for thinking the vertebral column was in actual fact straight. A lateral view shows that this is not the case. There are 2 primary curvatures that occur during our fetal development, and 2 secondary curvatures that occur as we start to weight bear during early childhood. The thoracic primary curvature is referred to as a kyphosis, as is the sacral and coccygeal curvature. Kyphosis refers to the curvature that will bulge out to you were you to be looking at the posterior aspect of an individual's back. The cervical and indeed lumbar curvatures, the secondary curvatures, are deemed to be lordoses. That would be the opposite of a kyphosis, in that it would dip away from you were you to be looking at the posterior aspect of an individual's back. The cervical spine. The cervical spine comprises of 7 cervical vertebrae that are numbered from the cranial or head end towards the caudal or tail end. C1, or the atlas, is the vertebrae that articulates with the occipital processes of the skull. C2, or the axis, articulates with the atlas at the atlantoaxial joint. C3, C4, C5 and C6 are deemed to be typical cervical vertebrae, whilst C7, or the vertebrae prominens, is deemed to be atypical, along with the atlas and the axis. A typical cervical vertebrae has a bifid spinous process. The vertebral body is somewhat smaller than that of those within the thoracic and lumbar regions, and the transverse processes have transverse foramina, which are holes that transmit the vertebral arteries and veins. It is worth spending some time looking at the zygoapophyseal joints. These are the joints between the superior articular process and the inferior articular process of vertebrae, and the angle of these joints explains the wide range of movements permitted at the neck, namely flexion, extension, and lateral flexion. C1, the atlas. The atlas, or first cervical vertebrae, C1, is deemed to be atypical, as it does not have features that are consistent with those of a typical cervical vertebrae. There is no body, and instead there are two lateral masses. These lateral masses bear the superior articular surfaces that articulate with the occipital condyles of the skull. This occurs at the atlanto-occipital joint, a joint that permits nodding of the head. In addition, there are anterior and posterior arches that both bear an anterior and posterior tubercle, respectively. There are two transverse processes in keeping with other cervical vertebrae that bear transverse foramina, transmitting the vertebral arteries and veins. In addition, there is a facet on the anterior arch that is for articulating with the dens or odontoid peg of the axis. This occurs at the atlanto-axial joint and permits shaking of the head. C2, the axis. The axis, or second cervical vertebrae, is deemed to be atypical along with C1 above it, the atlas, and C7 below it, the vertebrae prominens. It has, on initial inspection, many features that are in keeping with those of a typical cervical vertebrae, namely a body, lamina, and a bifid spinous process. There are also the transverse processes, in common with other cervical vertebrae, that transmit the vertebral arteries through the transverse foramina. The striking feature that actually makes the axis atypical is the dens or odontoid process that articulates with the posterior aspect of the anterior arch of the atlas at the atlanto-axial joint. This joint permits shaking of the head or rotation. Thoracic vertebrae. The 12 thoracic vertebrae are larger than the cervical vertebrae above, but smaller than the lumbar vertebrae below, related to the degree of load bearing that occurs across the thoracic spine. There are a number of features in keeping with cervical and lumbar vertebrae, including a body, pedicles, lamina, and spinous processes that complete the vertebral arch. In contrast with the cervical vertebrae above and the thoracic vertebrae below are the angles of the superior articular facets and the inferior articular facets that determines the specific movements permissible across the thoracic spine. Another clear-cut feature that distinguishes a thoracic vertebrae from a cervical or lumbar vertebrae are the articulations with the ribs. These include superior demifacets and transverse costal facets of a vertebrae that articulate with the numbered rib of the vertebrae. There are also inferior articular demifacets that articulate with the rib below. Lumbar vertebrae. The 5 lumbar vertebrae are the largest vertebrae of the vertebral column. In keeping with the cervical and thoracic vertebrae, there are many features in common. Bodies, pedicles, transverse processes, laminae, and spinous processes complete the vertebral arch. There are superior articular facets and inferior articular facets that determine the range of movement across the lumbar spine.